Hi, it's Dr. Fox, licensed psychologist in the state of Texas, and in this video, we're going to ask and answer the question, are you BPD quiet type? Subtypes may be a bit confusing as a term, as it implies that there are subtle underlying factors that are mutually exclusive, totally separate, and unique. Like cookies. Cookies is a larger category, but there are a ton of subtypes, like Oreos, chocolate chip, double chocolate chip, oatmeal raisin, a whole bunch of different kinds of cookies. Now, although these are different kinds of cookies that appear separate, they have many things in common, right? That's like sugar, flour, and other ingredients. In the case of BPD, the subtypes have some distinction, but they have many factors in common, such as abandonment fears, rejection sensitivity, emptiness, high probability of relationship disruption, and so forth. Now in this video, we're going to discuss the quiet borderline PD type, what factors distinguish it, and what situations encourage its development. Like all my videos, I will go over these issues, but also provide you with a tool tip to help you manage it and grow beyond it. If you're interested in doing a deeper and more personal dive, I want you to check out my workbook, the Borderline Personality Disorder Workbook, and it might be able to help you not only identify your subtype, but also help you learn some strategies to manage and deal with it, as well as getting really good insight into that core content of what's underneath it. So like, share, and subscribe, and let's get into it. So what makes up the quiet borderline type? This is also called the discouraged BPD type. And typically, the factors that contribute to this subtype are these individuals tend to be more clingy, which means that they really want to attach to others. They really feel a need to be close to others, and they have difficulty with any type of distance from those identified others. And that could be a partner, could be a close friend, likely a favorite person. If you're not sure what favorite person is, I have videos on that you might want to check out. Also, individuals with this type also, they tend to follow the crowd, which means that, they kind of go with the flow. They kind of go with what everybody else is doing. They have difficulty sort of asserting their own opinion. Often also with this subtype, you see a lot of dependency, almost like a dependent personality disorder type, is they're really connected to others. They have real intense difficulty making their own decisions without the okay from someone else. Now that okay could certainly be their favorite person, could be their significant other, could be a family member, could be their boss, whoever it is. But again, so you see this dependency that's there, this dependent personality disorder type. That doesn't mean that they also qualify for dependent personality disorder, but it means that they have a lot of those features, that dependency feature. Often they are angry inside, but they can explode if they're pushed. Typically, that anger just kind of builds. It's this over-controlled type of hostility. So they stuff it down, they stuff it down, they stuff it down, and the anger just builds. It becomes more intense. And then what happens, like any kind of pressure cooker, is that as that pressure builds, that eventually they explode. And we see that in the quiet borderline type. Now also, these individuals are likely to harm themselves. Now, sometimes they may harm themselves for reasons in order to garner attention, in order to let others know kind of the suffering and pain that they're going through. So they are at a higher probability to engage in self-harm. So that's really important to know. And if you're thinking about hurting yourself, it's always important to reach out to get help. And it's really, really important that to seek out a mental health provider that can also help you as well, so that you can learn adaptive strategies away from self-harm, as well as other more effective ways of managing these different types and tendencies that we're talking about. So also, quiet borderline type, these folks also tend to be kind of moody, gloomy, and quiet. Now, moody, a lot of folks might say, well, all people along that borderline spectrum are moody. Well, I think that in this type, in this quiet type, we see that there's a lot of could be quiet, kind of pouting. They get these sensations of, intense mood, low mood, intense mood, low mood, which you do see in the other borderline types. Remember, right? It's like sugar. It's like flour. So we're going to see some of those factors as well. Also, for this subtype. We see suicidal thoughts, gestures, attempts, and possible completion. So again, it's really important to call the suicide prevention lifeline in your country. Make sure that you're reaching out, getting help, and that's really, really important. The comment section here is not an emergency resource. I know sometimes people will write and say that they're thinking about hurting themselves. There isn't a way for me specifically to help you because this is not monitored. The comments are not used for that. So again, it's important to reach out to those suicide prevention lifelines as best you can. Now, let's talk about the etiology and origin. Now, the purpose of understanding etiology and origin is to assess the impact of the past on the present. This helps identify a trajectory for treatment, right? We want to know where we're going, how the past affects how you live today, and how you can reconstruct how you live today and lessen the effect of the past. And it is possible to overcome issues from your past. It really is. So let's talk about those possible etiologies of that quiet borderline subtype. Initially, these folks became overly attached and dependent on the caretaker, and that caretaker discouraged autonomy and exploration. The caregiver restricted the investigation of your environment, perhaps enhanced fear of the world outside, while you contended with fear of your caregiver, right? So you're afraid of the outside world, but you're afraid of the caregiver, but the caregiver is supposed to look after you, but they keep telling you how scary everything is out there and all the dangers, and then you're also afraid of them because they tend to be inconsistent in many ways, and it's difficult to rely on them. Now, also, possible etiologies is the home tended to be neglectful of your needs. This is emotional and physical, and it can be material as well, such as food and clothing. Now, another possible etiology is permissive or authoritarian parenting is most common. You had no clear boundaries or understanding of what you could or couldn't do. Now, this can lead to that lack of developing an internal scale of want, should, and need. And it's really important to be aware of that, and we see this in adults. A lot of folks with BPD are often unsure of the decisions they should make, what they want, what they should do, and what they need to do. So there's a lot of that confusion that's often in place. Lastly, the possible etiology is that children are seen as a burden. They're in the way and often trusted with little value. So you don't develop a core sense of self and value. This gets internalized and becomes a central issue in your life and how you see yourself and your relationships. And these etiologies, it's important to realize that we can't just blame every parent. We can't say, oh, I developed, quiet borderline type because of, it's always the parent's fault or whatever. And that just isn't true. There's a lot of different trajectories in the development of a personality disorder. And so we don't want to just blame the parents. We don't want to make it seem like, it's all bad parenting, because that isn't true. Because we do see cases where individuals do develop the quiet type of BPD, and they had a relatively stable home life. They had sort of a traditional caring parent who tried to help them out, and other things happened along the way that caused that sort of disruption from a more adaptive trajectory and development. So let's talk about how do you deal with it. So let's say you feel like you fall into this quiet borderline type. Well, how do you deal with it? Well, first, you have to recognize the need to know that these issues exist. If you don't know what it is, it's hard to deal with it. So we want to build insight. We want to understand what's going on and what makes up that quiet borderline personality disorder subtype. Number 2 is that focus on your worth and building it up. Now, this can be through a support group, one that helps you explore your issues, talk about them, while providing you an environment of safety to be yourself. And that's really, really important. I know that a lot of folks along the borderline spectrum don't like groups because they have issues trusting others, but finding that healthy and helpful and supportive group can be a huge, huge benefit to them, right? Because finding that support can be really important, particularly for the quiet subtype, because I think they're often very internal. And because of that quiet tendency, all those moods that are going on and all of those other tendencies that are building up and all that pressure that's underneath, that over-controlled hostility that stays in there and that builds, I think that group provides an effective and adaptive outlet. Now, groups are going to be scary, right? And it's going to be different. But remember, being scared just means you're about to do something really brave. What about number 3? And lastly, build assertiveness skills to get your wants and needs met. Learn how to be direct and appropriate. Now, the DBT skill, Dear Man, is a great tool to help you do this. And I'm going to go over it really fast right here. So Dear Man, you can break it down in that you describe, express, assert, reinforce, stay mindful, appear confident, and negotiate. So that D for describe is describe the current situation. Stick to the facts. You want to tell the person exactly what you're reacting to. And then you want to express your feelings and opinions about the situation. You don't want to assume anything, right? We always want to express our feelings and opinions, and we want to be sure that they're always clear. And you want to, A is assert yourself. So assert yourself by asking for what you want or saying no clearly. And I think that's so important, particularly for that quiet borderline type, because it's difficult for them to be assertive. But being clear and asking for what you want, it doesn't mean you're going to get it. But if you ask clearly and directly, you're at a higher likelihood to get what you want. But also, be assertive in saying no, too. Because I think sometimes that borderline type, that's where that dependency component comes out, right? That dependent personality factor or traits that we mentioned just a moment ago. I think that comes out because they're afraid to say no, because if they say no, then that person will leave them forever, which goes back to that rejection sensitivity. Let's talk about reinforce. Reinforce rewards, which is you want to reward the person ahead of time, so to speak, by explaining positive effects of getting what you want or need, right? And also, if you have to, you can clarify the negative consequences of not getting what you need. Such as, it would really be a big help if you could do A, B, and C for me. If you can't, it creates this or this for me. It's just explaining clearly what you need and also reinforcing that individual by certainly being pleasant, by also being clear, by also rewarding that individual as well. Now the M, you want to stay mindful. You want to stay focused on your goals. Maintain your position. Don't be distracted. Don't get off topic. Is that you just want to stay on your goal, stay focused and stay present. And then the A is appear confident, appear effective and competent. Use a nice, strong voice. Clearly say what you mean in a confident manner. And even if you're not confident on the inside, act as if you're confident in order to get your needs met. And lastly, negotiate. And this is be willing to give to get, right? Offer and ask for other situations to the problem. And sometimes you're going to have to reduce your request, right? You're going to have to negotiate. You may not always get exactly what you want. So you got to be careful of the split, right? Because the split is, I want this and it's the only thing that I'll accept. Regretfully, the world rarely works that way because we always have to negotiate. What are some other options? And giving yourself options doesn't mean you failed. It means that you're willing to negotiate, be flexible, because it's better to get 90% of what you want than none of it. It's better to get 80%, 70% of what you want or even what you need than it is 0%. And that's really important. It goes to that percentage, that probability. So I hope that this video provided you some insight on the quiet borderline type. Please leave any comments or thoughts that you may have. And thank you very much for your time. I appreciate it, and please be well. Bye-bye.